everybody. Good morning, good afternoon, good evening to wherever you are. We are back with season two. I gotta put my fingers up to the screen. We back with season two. Season two is popping off here at the Public Health Gems podcast. We're so excited to jump into a great conversation with a subject expert matter in her space and a lot of great insight to share. But before we even get into that, let's talk about the public health joiner. This is your first time joining us. We gotta just hop
Yeah,
back for a second and say who we are, right?
yes, most definitely, most definitely.
So the public health, John, we are here for community, for consulting, as well as coaching. So coaching young professionals in the field that are doing wonderful work in the health space. I call it my equity champions, consulting these great organizations and businesses to advance these health outcomes that we see, and then also building community. And that's why we're all here today, to have these great conversations, forge community, and just learn a lot as we go through. So the Public Health John podcast, Gems podcast, has come through all this different collaboration and just learning from those in our community who are sharing and doing and just being great great professionals.
Yes, yes. Let's go.
Yes, so we are going to jump into our episode today. And as I mentioned, we are in season two, so we are just switching it up, changing it up. We just got different flows going on, and you'll hear a lot of that happen today. But I want to introduce our special guest. We have Dr. Lola in the house. Say hi, Dr. Lola.
Hey, y'all. So we out here, we doing it. Let's go.
Exactly. I mean, that's what it's all about. She's bringing the energy for spring, okay? If you are looking at
Yes.
YouTube, you're going to see this bright, beautiful yellow, and she's going to tell us all about what she does. But Dr. Lola, she is a physical therapist, and she is a fellow of the American Academy Orthopedic Manual Therapist. She practices in Austin, Texas. Okay, Texas, come on through with it. Hey, all right. And she is a first generation Nigerian American from Fort Worth, Texas. She
That's
attended
right.
she attended University of Texas in Austin. I got to get that right, where she got her BS in kinesiology and health. She continued her education at the University of Incarnate Word, where she graduated in 2018 with her doctorates in physical therapy. She's going to tell us all about her journey, so I don't want to give too much of it away in her bio, but I do want to say one important thing that really stood out here is that her platform, which we'll learn about in a second, as she is an entrepreneur
Yeah.
in health, that she aims to bridge the gap in between healthcare and technology through curating events such as healthcare, health tech, networking event, which we'll get into, and she gave this little tidbit with us today. I love this nugget that she includes. One of her hobbies include cooking plant-based meals and watching Grey's Anatomy. So
That's right.
we love that. So Lola, speaking of that, before we actually get into our conversation, and we know now is officially springtime, spring is in the air. What is your
Yes.
favorite activity to do in spring? Just to kind of give us a little bit of what you like to do. What's your springtime looking like?
You know what? For spring, I like rooftop activities, okay? Because here in Texas, summer is boiling if you're outside, but spring, I feel like it's a nice, still like nice and cool, still like really nice. So, outdoor, just like breezy social gatherings, rooftop preferably.
Listen, you say rooftop, I'm there. I'm like, say less. Public health Jones, in the fall we gathered on the rooftop. We might have to do it
I
again.
know.
We might have to come back for the
I
roof.
think it's time.
But I'm going to jump into our conversation here, and I have a first question that we're really curious to know. Lola, can you tell us about your background and how you started your journey in physical therapy? And also, if you could share about your current role as a physical therapist, what does that look like on a day-to-day for you?
Yes. First of all, thank you so much for inviting me onto your podcast. Active listener to Public Health Gems, because you always be dropping the gems. Okay. So thank you so much for having me on and just sharing this platform with you. Yeah, but my journey, it just started so long ago. So I've always wanted to be a physical therapist in the sense of I've always wanted to be able to help people. So I knew growing up that I need to do a profession. Not sure if it was going to be in healthcare, which is funny because present day what I do, right? But in my business, but I just knew I wanted to do something to help people. So I feel like typical physical therapist story, you get hurt in athletics. And for me specifically, I went to physical therapy and I found myself taking what I learned in physical therapy in my sessions and then going to like my fellow athletes and being like, oh, you're injured too. Like, look, this is what I learned. Let me help you, this and that, not knowing anywhere if what I was showing them was even relevant to what they had going on, right? But I was in high school. So I was like, okay, when I go to college, like I know I want to do this thing. And so, yeah, so I really say, give big testament to God because I feel like my journey literally is a journey and a testimony. I started out at one program for physical therapy and I got dismissed from that program. And at that point, I really thought that I didn't know if I was going to be a physical therapist. I really thought that maybe I was going to do something else, but I still was in the realm of like, maybe I'll do something in athletics or more on the management side, something more on the business side, to be honest, like health management or something. And so the way God had it, he said, no, like this is the path I have for you. And so I got accepted into another program in San Antonio. And that's where I completed my physical therapy, my doctorate in physical therapy. So shortly after that, I went and I did residency in orthopedic and manual therapy. And then I followed up by doing a fellowship in sport and manual therapy. And yeah, and now I'm working in Austin at an outpatient clinic. And then I also have my own practice and socialite, the socialite PT as well. So I love it because I feel like it's such a you don't know what your story is going to look like, right? But, a just real testament to God and what he did for me and just bringing me through different stages to where I am today.
Absolutely. No, thank you for sharing that. And
Yeah.
it makes me think of a conversation I just had with some other public health professionals in the field. And one of
Mm-hmm.
these professionals, they said, before I do anything, like I'm getting on my knees and I'm praying. And I love how we
Mm-hmm.
can just talk about that in these spaces about what God's plan is for our lives. And we are
Yeah.
just really excited about what you're doing. So I think that's a great segue to say
Mm-hmm.
and thinking through. We're excited to learn more about the socialite PT. Uh,
Yeah.
you, yeah, we are just like, we're over here. If you see me on YouTube, I'm doing my little dance moves at the desk.
Look,
Hey, I'm trying. I'm
both
trying.
of us are dancing.
All right. Look at the professor's shoulders moving. Can you tell us about how you combined your love of physical therapy with the creation of the socialite and how is everything going? What should we be looking forward to in this spring for you?
Look, let's talk because if anything, we're going to be social. Let's go. So, Socialite PT is my baby, my business. It's so crazy because I always say I never saw myself as being an entrepreneur, a business owner. Like that was not in my plan. I think in PT school we did like a short stint of like make your business plan or something like that. And I was like, oh my gosh, like this is horrible. Like this it's not fun. And so, but again, there were just other plans for me. So, Social APT started in 2020, where I feel like a lot of businesses, small businesses started. And it was just really originally started as an avenue like, hey, so much is going on politically, socially within, the Black community. And like, where is my community? Where are the Black women in healthcare? Where are we connecting? What does that look like? You know, there's less than 5% of Black physical therapists, let alone like a majority of us in our clinics and places of work. We normally don't see anyone who looks like us. And so, with that being said, when everything was going on politically and socially, there really wasn't a community in person and within the workplace to really confide in. And so it's like you're putting on this face, you're going to work, dealing with so much, thinking about what's going on with George Floyd and everything else, and then having to like go home and just literally decompress and just really say like, oh my gosh, like let me call my friend or let me call, my community and see, hey, are you guys also processing this the same way as me? So I was like, I want that community. I want other Black healthcare professionals to know that, hey, we're here, we support each other, we have resources, we have a network, let's grow that, and that's where the socialize PT, that's where we stem from. And so since we've grown it, we have more members within our community. We do interviews, we host networking events, and really just to show that there's so many different dimensions of healthcare. And I feel like a lot of times when people say healthcare, we're not including other realms. We're normally thinking like nursing, pharmacy, medical doctor, but we're so wide, we have public health, we have like health tech, so many dimensions, even dietitians. And I just wanted everyone to be involved within this community so that we can be a resource to one another.
Absolutely. We're getting social. We're getting social. This
Look, and I didn't even answer all your questions yet,
Listen, we're ready for it. And I love this inclusive community that you have created, been able to participate and just be a listener,
Yes.
be a viewer myself and everything that you're doing. So just love the work. And this goes into something that you said from the last part of that question. So you talked about during 2020, with police brutality, when just Black Lives Matter, when so much is going on all at one time, and having to intake this as like digesting it from news, from the media, all this, like you mentioned, talking to friends, talking to other people in the field, like, are you going through the same thing that I'm going through right now? So we know that with jobs in healthcare, that there are a lot of different disparities. There's a lot that we see. So just thinking about the self-care component, we saw a post on Socialite on their, on social media, and we thought, hey, let's ask about that. Let's tap in. So this is a perfect time
Yes.
to answer that. So tell us about the importance of self-care for health professionals. Can you share more on this and just tell us about your go-to self-care practices? What do you do for your activities and routines?
Yes, I love this because I'm having to learn more to practice it, right? I feel like healthcare burnout is so real. It is so real. And me in particular, I worked through COVID. So there really wasn't any time to decompress. It was just continuous process. What's new? What's changing? What are the health precautions? What can we do? What can't we do? Are we safe? Are we not safe? And so I really had to, like, after like the initial height of that, come down and think like, wow, like, am I like mentally sound? Like, how can I ground myself? And so for me, it really is, the funny thing is, it really is building and working with other people. So having that social component, that's really big for me. Having relationships, just where you can communicate with other people. By myself, watching Grey's Anatomy, guilty. Definitely, I binge a little bit, but yeah, just like coming down, I've started reading more because I feel like sometimes even like watching TV or just being on your phone all the time can like be a lot of stimulus. So I started to read more just to kind of ground myself, and a lot of like, business or just like light self-help books. And that's been really helpful to me. But really, like, self-care is just being around, loved ones. And then also for me, being around loved ones, and then also just partaking in those things that, sometimes I forget, like, oh, I really enjoyed doing this. I really enjoyed watching this or reading this. Like, let me tap back into that.
Absolutely. I'm getting into reading some of these books as well. I know.
Yeah.
Oh my gosh. I've been creating a couple of posts here and there, like, what books is everyone reading? But now
Yes.
let me go through this list. So I love, and someone said this on a podcast recently. They said, I'm kind of turning my brain off when I'm reading. I'm like, that kind of makes sense. It's like the TV, the cell phone, the TikTok, all those different things. But then when you read, you're kind of like transported to this different world. And I love that part.
Yeah.
So love that.
Same.
You have to
For
have.
sure.
So
Yes, and I know you're a big book reader because I've seen those books that you posted on your page. You might need to create a little book club. I'm not trying to give you more work,
yeah,
but
I've been thinking about
let me sign up.
I've been thinking about that. Public Health Jones, look out. We might have to
Look,
a little book club, a little podcast, something. I don't know. We'll talk about it. We'll talk about it. We might
okay.
have to collaborate on that.
Hey, I look at the collab. Look, we already collabing. Y'all, if you aren't on YouTube watching this, we decided to dress alike today, okay? All right, it's all about the brands, all right? The black and the white. I love it. I love it.
That's it. That's all. So we just talked about self-care for professionals, and I think another thing, as we're professionals in the field, in the health field, that is thinking about health equity, meeting people where they are. So
Yeah.
as someone who is a leader in your field, as someone who is a professional in your field, how do you create safe space and equitable
Mhm.
spaces, whether we're talking about for your patients or whether that's on
Yes.
the frame of socialite? How do you do that?
hmm I feel like as a Black woman, and then also holding that space as a Black healthcare professional, there's no way that you can't relate to your patients because a lot of those experiences you are also going through when you go to your doctor visits, especially if they don't know you're a healthcare professional. They just see you as, you know, this Black female patient. And so I make sure I hold space for my patients and just communication. It's so important to meet people where they are, but then also just listen to them and then make sure that you are making sense. Because I feel like in all our fields, we get, caught up in how we talk in our meetings or how we talk with our coworkers and things like that. But, you know, we're used to that, but our patients are not used to that. And so, I ask a lot of clarifying questions in interviews with patients like, hey, like, did that make sense? Or like, hey, if that didn't make sense, let me know so I can clarify that for you, or let me know so I can explain it a different way. And I'm a visual learner. So, like, I love bringing out like props, things like that, and just making sure patients feel heard and seen. A lot of times, it's funny, there's a joke with physical therapy that we're not just like physical therapists, we're also therapists. And so patients will like, find, because we spend a lot of time with our patients, evaluations can go anywhere from like 45 to 60 minutes, depending on what setting you're in. So whereas a lot of like other healthcare professionals, they're not a lot of that time with their patients. And so it's kind of in and out, in and out. So, we're hearing a lot from about our patients' families to about like other experiences. And so, and I really tie this back into the importance of having a network, because a lot of times with patients, they'll say stuff to me that they haven't even told their primary care provider. And so I'm asking them, hey, did you tell your PCP about that? And if not, why not? And making sure and also kind of coaching a little bit like, hey, when you go back to your visit, this is a way you can frame that if you're not sure how to go about asking, and you can make it your own. And then also saying like, hey, like, I know you said this and this is going on. Here are some referral sources, especially even like now within healthcare. It's so important to have mental health resources too, for your patients, which wasn't really common back when. But now I definitely feel like with mental health being a more of a prominent like topic, definitely important to have those resources. So with the socialite PT, I'll have other practitioners asking me like, hey, I have a patient in, I don't know, New York who's seeking XYZ service. Do you know anybody? And I feel like that is the importance of networking, especially as healthcare professionals, so we can help our communities and make sure everyone gets the resources and feels seen the way they need to.
Absolutely. I was just thinking about this. I've been
Okay.
able to see this firsthand of how you have been a connector in these spaces, for
Yes.
what you do on the work front, and also with your business and how your mission and your goals, it speaks to this. I also had in this question, and I always do my loaded questions, but events. Can you tell us more about your events? What might be coming in the future? I'm raising my eyebrows like, hey, hey.
Yeah.
And we just want to hear about how you connector in those spaces too, because I think that's really important to highlight.
Yes. Okay, so our events, if you know me, you know I'm a networking queen. Look, I love a good event. So our events are all around connecting, educating, and that can be educating in regards to, for because we have a lot of healthcare professionals who are business owners. So definitely dropping those gems, having special guests to educate, having panelists. You've been on one of our panels before, and just creating those environments. We 2023 launched our one of our biggest events during Afrotech conference in Austin called Healthcare Health Tech, and it was amazing. We had our panel, which you were on, and it was just a great experience in the sense that it was founded off the idea of like where are healthcare professionals in the tech space, And, going as a guest with some of my friends, some of these conferences, I just didn't see where healthcare professionals were in the tech space. And so it's like, okay, well, if I don't see it, I'm gonna make it. And so, and so that's what we did, me and my team. So we created our event, and we said about coming up. It was such a big success. We had so many people who wanted to attend, who weren't able to attend. And so we're making it bigger and better for this upcoming year. So we'll be in Houston in November. And so make sure you come out. And yeah, it's gonna be a great time. We also are planning to have our official launch event this upcoming summer as well. And it's going to be in Texas. So be on the lookout for that. And I'm going to plug myself real quick. And if you don't know where to be on the lookout for that, we just launched our website. So make sure you go follow us on Instagram and other social medias at Socialite PT. And you can sign up and you can be involved in the community, learn more about us, and see what our events have to offer.
No, Public Health Jones, I hope you are listening and writing it down. If you have not, that's all right. It's in the show notes. We're going to have it there for you. So just take a peek there and you're going to see it. But we are just so excited about the upcoming events. I, like you mentioned, was able to be in attendance for the last one and be a panelist, which I was just wonderful opportunity to just talk.
She was amazing. Like, she's not even, let's boost her up. Okay. She was amazing. And if you're not sure who needs to be on your panel, right here, the Public Health John, she be holding it down.
It was a wonderful and beautiful time, and we can't wait to the next event. So already have it in my calendar. I'm ready to go.
Yes. Come on.
So before we close out, one more question, and you mentioned this a little bit earlier too. Just thinking about the state of the United States with public health professionals, with physical therapists, you mentioned doctors, all of us in these different health spaces. So we know in the US that there is a clear underrepresentation of DPTs of color. And so that I got a little data, I was doing some research, but it said that data from the American Physical Therapy Association says that about 2 to 3% of physical therapists are Black in the United States. So can you share your thoughts on that, about how important this representation is for all of us across healthcare settings, of course? And then what does that mean to you as a business owner and as a DPT yourself?
Yeah, thank you so much. Good research, because that's definitely correct. It's unfortunate. I feel like, physical therapy as a profession, like a majority of healthcare professions, there's a big disparity in the amount of Black healthcare professionals. And it's sad because we have so many of our patients and so many of our communities that aren't seeing that representation, as well as so many of our next generation coming up who don't know because they don't see. When they go to the doctor, their doctor might not look like them. When they're going to XYZ healthcare provider, they don't know if that's a field for them because they don't see individuals who look like them. And so, I love that there's just such a big catalyst for change, your platform, so many other individual platforms, my platform, that are showing, hey, we're out here and this is something that we did. You can do the same thing too, and we need to make sure that we're showing up in these spaces. One of the big reasons why I created the Socialite PT, but also one of the big reasons why I created Socialite Physical Therapy, which is my private practice. And that was really important to me because, I noticed as well within my community, I'm like, people don't have a physical therapist that looks like them that they can go to. And that's a problem, especially we're all living in these major cities. And, and we have individuals who are seeking out that help. And so that was really important to me in regards to like, okay, I need to have this practice, it's part of, my social, but also professional responsibility.
Absolutely. It's like creating that representation. So like you mentioned, the next generation of health professionals will know and they could do. And like you said, there's that need. So fulfilling that need and making sure that everybody has what they need, and they need us.
Yeah.
So it's great to be a part of that circle with you. I'm really excited as we continue more conversations, but I know for this one, our time unfortunately is up. You are a busy woman doing lots of great work.
No, that's you. That's
gonna give you some time back.
Look, if y'all don't know, Public Health John should be moving and moving. I don't even know. She'd be moving and moving. She's booked and busy. So if you're trying to book with her, make sure you go ahead and go on her website. Go ahead and contact her. email her, okay, for your
Listen,
panel,
we
your
are
interview.
moving. You are so right. We are definitely moving. That is probably the best descriptive word, especially as we continue to gain momentum and build this beautiful
Mhm.
community. So we're so glad that you stopped by today and joined us
Of course.
for such an enlightening conversation. And of course, it dropped gems on us on the Public Health Gems podcast.
Yes.
The information you shared is so valuable. It provides insight to us in the field, but like you mentioned, the future generation of the community of health professionals. So you dropped
Yes.
this a little bit earlier, but tell us again, if folks want to connect with you, where do they find you? And tell us a little bit more about
Yes. Yes, I'm most active on Instagram. So at the Socialite PT. You can also find me on TikTok at the Socialite PT. And then if you want to email me, want to work together, if you're looking to sponsor, to partner with us on some of our big events, especially healthcare health tech coming up, it's Lola at thesocialitept.com. And if you're just like, I need everything, you can find me at thesocialitept.com. Okay.
that. Check, check, check. We need it. We need it. And we're going to have it in the show notes. We look forward to seeing everyone for this season 2 of Public Health Gems. We have so much great information to share, great experts just like Lola in the space. We're going to drop her information so everybody has it. But until next time, we will see you on the Public Health Gems. Bye, everyone.
Bye.